Hello, hello, hello. This is Kenny Perkins, aka the Cancer Guy, and I wanted to bring you inside the vaults, as we call this. This is where radiation oncology treatments take place. This is what we call a LINAC Accelerator. So for any of you that are out there that are getting ready to have treatments, and they say, "Hey, you got to have radiation," this is what you come into. And so a lot of people are terrified because they go, "Oh, radiation is something that's going to burn me. It's going to, cause all kind of damage to my skin, and I'm going to have a hole." And a lot of that is just, old folk tales. Radiation has come a long way, and it has been such an amazing thing in helping curing cancer. So I wanted to kind of bring this to you, kind of get an idea for those that have been diagnosed and on their way to having radiation treatments. This is what the machine looks like. We call this a LINAC Accelerator. And so nothing to be afraid of. Again, you don't feel anything when you're having the treatments for radiation. It's kind of like being in the sun, right? You don't feel it when you're getting a suntan. The rays, they don't hurt, but the effects you do see, right? Your skin changes colors and whatnot. And it's the same thing with radiation oncology when you're getting a treatment for radiation therapy. You don't feel anything when you're actually being treated. But let me tell you, over a period of time, 2-3 weeks, there are side effects, but nothing about, oh, you're going to be burning or whatnot. That's just a folktale. As far as burning in the sense of you're going to have a hole. Your skin does, there is breakdown in the skin, and talk to your physician about that, what to do, because when skin breakdown does happen, there's precautions and things that you can do to kind of help minimize the full effect of that. And so there is, I want to be clear on that. There are side effects to radiation oncology, but nothing like burning a hole in you and things like that. So this is what the machine looks like. As you can see, you're kind of in some bungalows back there. You try to create an ambiance for the patient. This is what you lay on. And then the actual treatment comes out of this collimator head. Is what we call a collimator head. Comes out of that. And if you're wondering, everyone goes and they get an X-ray. An X-ray, it's what they call, they measure in kilovolts, right? Which is 1,000. It's a fancy word for 1,000. Whereas radiation therapy, it's actually in megavolts. And megavolts is millions. So this is about 1,000 times stronger than an X-ray. And the reason why is that you're using radiation as a treatment versus as a chest X-ray or an X-ray of your hand to kind of get a diagnosis. Is it broken? Yes or no? And so, excuse the long tangent, but I do wanted to give you an insight of what radiation oncology is about and where the actual treatments take place. This is kind of where it all happens. This is kind of my expertise as well, like I've always extended, right? Radiation therapist, cancer coach, and then now here we are, we're doing, podcasting on All Talk Oncology. So as a host and the creator of All Talk Oncology, this is a LINAC Accelerator. And the amazing thing that we're going to be doing on All Talk Oncology is bringing in different guests so that we can educate you and empower you on what it is that you need to know about your treatments so that you can go in with confidence and certainty. And so that's what we do at All Talk Oncology. I wanted to bring that to you. I wanted you guys to kind of get an idea what this looks like. Nothing to be afraid of. If you're getting ready to go through treatments, you have any questions, shoot me a DM. We can discuss it. I'll be more than happy to kind of give you an idea what to expect depending on what your diagnosis was and what your doctor is saying that you need as far as radiation treatments. But again, as I always say, and I hope that you know this, you are not alone in this. We are in this together. And if you have any questions, shoot me a DM, look me up. My information is below. You can find that. Again, this is Kenny Perkins, aka the Cancer Guy. And until again, I'm out.